everyone, this is Tammy, and today I'm going to be testing my ketones in blood and urine. I already just collected my urine in this cup right here, and this is my favorite brand for testing ketones. You can find this at Walmart. Sometimes it will not be out in the aisles, but you can ask the pharmacist and they can give it to you. You don't need a prescription to buy this ketone strips, and they're around $6 for 50 strips. This, I hear a lot of people saying that they're not accurate, but in my experience as a laboratory medical scientist, I can tell you that they are reliable. It's just that you need to understand how to interpret the results, because just because you get a negative, it doesn't always mean that you're out of ketosis or that you're not doing the right thing. All right, so I think I'm going to start with the blood just because I don't want to touch any urine yet. For the blood testing, which is a more accurate because these are active ketones, on the urine we're testing for what is leftover ketones, okay? You produce the ketones in your blood and then it cleans out and get released in the urine. But if you use the ketones, you're not going to have anything left to show in the urine. And that's why it can be a little bit tricky and unreliable if you are not familiar with how the test is done. Now on blood is most accurate because those are the active ketones. And just because you have a low reading, which is 0.5 is considered trace or barely starting to produce ketones. But just like the urine, it doesn't always mean that just because you have a 0.5, you're not doing things right. It actually can be a good thing because that means that you're using your ketones. So just don't panic if you see a low. It is okay. This is the blood glucose and the beta ketones that I'm gonna be testing. So I always like to have these extra alcohol swabs, and you just clean the area. You want to wait for the alcohol to dry a little bit. And while I do that, I'm gonna insert the ketone testing first. And all you have to do is you put it on top like this, and then it's going to ask you for the drop of blood, which is right there. You want to make sure you have enough blood. And then get close until it beeps. There you go. And there you go, it's 0.4. Okay, so I'm gonna release that one. All you have to do is just press right here and it will release it. And then right now, before my blood dries, I'm gonna test right away the glucose. I don't wanna poke myself again. So I'm just gonna clean it off and then test. So you just insert this one. The brown one is for glucose. So I'm just gonna press in here to get more blood. There. And then the same thing. You just wait for that beep. And then of course with the same swab, you just clean it up. So as you can see, it's 73. And then it also gives you the hematocrit, which is a percentage. It has to do with your overall blood, your red blood cells, and then the hemoglobin. It's right here. It is calculated. It's a calculation. So now that we got that already, then I'm going to put this aside, and then to release it, you just click right here, and that's it. And then we put it aside. I don't want to contaminate my instruments with urine. That's the reason why I'm putting everything away. And now for the urine right here, I'm going to get one of the strips. This is how it looks like. And these are the levels. And just make sure you don't expose these to heat. And you are supposed to wait around, I'll say around 30 seconds, but more or less. I already see it changing a little bit more purplish. I don't know if you can see it on the camera. Maybe this way you can see it. And then you just go like this. It's already on trace. I don't know, you can see it with the light, the difference in color. You can see that it does have some purplish. At least I can see it in person, that it's exactly like this color over here. I don't think it shows the same on the camera, but it is right there. So I'm just gonna wait a couple of seconds more, and then maybe I will take a picture so you guys can see the difference. Maybe if I get the phone closer, you can see the changing color. Yeah, I think you can see it better in there. You see how it has some pinkish into it? So that would be a trace, which is, you know, it's right on track, because I don't want to have too much excess ketones. And I barely got into ketosis yesterday because I cheated over the weekend. So this is what I was expecting. And if you have any questions about these testings, let me know in the comments. All right, see y'all later. Bye-bye.